All right, we are live. Okay, a little bit cooler out right now. Was gonna have some other audience with me, but they've decided that it's just too warm, and so guess what? I'm gonna have to walk myself. So, oh well. Finally got some nice weather here. I think this is Average Joe Horror Stories number 8. Pretty soon I'm not gonna have enough fingers. We'll see. Maybe I'll grow a few. All right, so I dropped a video. Newest one was on snapping hip. So hopefully you guys will enjoy that. If you have any questions, you can go ahead and leave a comment, and I'll hopefully be able to explain it, give you some ideas. I'm finishing up another video coming up here. I'll probably drop it in a couple days, and that's going to be on how do you tell the difference really between snapping hip and just good old-fashioned osteoarthritis of the hip that'll wear and tear. So I'm working on that one right now. So that's coming up here in a little bit, hopefully. Things to come, things to come, things to come. We'll see. But talk about a horror story. I had one of my really good friends for a long time that moved down to North Carolina before I did. Shout out to Rick. He reminded me of a time when, this was a long time ago now, when worked in New York State, and we had a director up there, rehab director, program director, whatever they want to entitle, whatever title they want to give them. I like titles, but I also like to pay, you know what I'm saying? But it was, let's say her name was Patty, because that's what her name was, or is. Man, what a tyrant. Absolute tyrant. Talk about the difference between a leader and a boss. She definitely was just a boss. I like to think of myself as trying to become a leader, so we'll see what happens. Let's see what we got here. Hi! Okay. So, anyways, yeah. Always learning, always trying to improve. This lady, no, not at all. For years, we had people leaving, therapists, PTs, OTs, rec therapists. Had them leaving all the time, like revolving door. Whether it was a hospital-based inpatient, whether it was outpatient-based, you name it, they were leaving. I think I was there almost 15 years. Probably, what, 25? 25, I would be maybe 25 or 30. Therapist, PTs, OTs, speech, recreational therapist, left. In that time that I was there, the upper management, senior management, never thought, why the heck are so many people leaving out of this one department? Seriously, you would think that someone would open their eyes way before what transpired, which is what I'm going to describe. So, we had these monthly meetings, and like everybody does, I'm sure, most professions do. And senior management went in one of them. You know, they probably typically have to do some sort of like peer review. You know, everybody has a boss or a leader. And well, this was one of those times where Patty was being her typical self. She, you know, kind of condescending, demeaning, you know, excuse me, the typical things that you don't expect from a leader. But needless to say, she got a warning for him. The day I was off, because I was working the weekend, another good friend of mine, Haven't talked to him in a long time. Hope he's doing all right. He calls me up and says, "She just got fired." I'm like, "Nah, what you talking about?" Yeah, apparently she had hurt her arm or something. I can't remember exactly what happened, but I think she was in a cast or something. And she just come in, rip roaring mad about something, and senior management was there again, and that was the end of her. They let her go. Had security pick up their stuff, and she was hauled out the door. And so that was Patty. But let me tell you the horror story. The horror story I found out after the fact. So for years, I was trying to. This is when we're talking 25 years ago now. So this is when I was a physical therapist assistant at the time, before I went back and got my doctorate degree. And so I was trying to get, I had to get a bunch of volunteer hours. He had to write an essay on why you want to be a therapist, and why you want to come to such and such college. You had to have so many hours. So I was trying to get, at the time, the hospital to sounds bad. Trying to get the hospital to reimburse me for this, you know, so many years. You need to pay back and get some of your school paid for. Well, you have to apply for this once a year. So I applied several years. I kept getting denied. Like, okay, for some reason, I have no idea. They would never give you a reason why they denied it. You would just get denied. Well, after her regime was over, or the tyrant was gone, I got I got asking. You know, I'm like, what the heck's going on here? And come to find out, she was denying every single year. That sneaky, you know what? And not only that, I can't remember. I think I saw her at some conference, and she was all trying to be all happy and you know, you know, congratulating me for getting through school and yeah, freaking snake. So that is a horror story for me. I was so when she was gone that next year, not a problem. I got it just fine. So I mean, talk about two faced. Not two faced. This woman was like infinity faced. Ridiculous. So I'd like to get a shout out to those people out there who work hard, work hard, work hard, and persistence, pursuance, and you just keep going, keep going, keep going, and as long as you're consistent and you keep doing it, it'll happen. Excuse me. Hey, slice of pizza, give me a little indigestion. I apologize. So, so yeah, that was the regime of Patty, and so yeah, that was my take on that lady. All happy about it, and then she was the one that was keeping me from getting into not getting the program, but getting the hospital to even accept me, to possibly paying or reimbursing me for the schooling in the first place. I mean, they didn't. I mean, they got a good chunk. I think they ended up paying like, I don't know, 20 some, 25, something like that. K out of the 3.5 years through the doctorate program. So and they paid for most of my undergrad. So, but every year they do, you had to put in a few yourself. So, and so yeah, those were the times, and I think some of those times will be coming back because definitely for most medical nursing and therapy as a whole, because people are not going into it like they used to, and old people are getting older. They're going to need those services, and guess what? Your cost of college is through the roof, and getting paid when you come out is not going to meet that. So we have to come up with something different. But So that's my horror story number one. And that's cahoots to Rick for reminding me of it. I blocked it out like a bad memory. But, uh, so, horror story number two. So I'm, what was it? Third year in, fourth year in. It was definitely within the first 5 years of being a PT. That's when you think you knew it all. Yeah, you find out you don't. As long as you keep learning and keep going, you'll be all right. That's my motto at this point. When you think you know it all, you realize you don't know squat. Uh, but so I was doing inpatient, and this was one of those times where everything was going good. Everything was going good until it wasn't going good. And excuse me, we were doing. I think our last patient we saw was at like 5 in the evening, so or 4 o'clock, 4:30, somewhere. I was doing an evening outpatient. We were seeing patients a little bit later, and so everybody had gone home. Inpatient staff were already gone, and so it was me, and I think if OT was there or someone was documenting. I can't remember, but or I might have been Matt. Matt might have been there. I can't remember. The other PT, really, really good friend, really, really good friend, and we were in the hospital. We were on the second floor then at UHS, and it was this boyfriend girlfriend that came, and I was treating the girl, and the guy seemed really kind of sketchy a little bit, you know, one of those control freaks where, you know, he probably is the one cheating on her, but he was always afraid that she was going to cheat on him. One of those kind of weird scenarios, and so we had a spot where we would put people's purses or valuables of some sort when you're putting them on the bike or the treadmill or whatever like that. So we put stuff in the upper cabinet, and yes, it was. I can't remember. I think it was Matt. I can't. It probably was Matt. He used to work. He worked like a dog, like I did. We'd work late, and so I think it was this squirrely guy, and come to find out, he had taken. I think we found out later that he had taken the other Matt's patient's valuables that we didn't even know about. We were on the other side of the hallway. One side was where we did all like the hands-on stuff, and then the equipment was literally, a hallway away and an open doorway. And so we were over there, and come to find out, so we had to have the police come and had to do stolen stuff, and it was crazy. We didn't leave there till late. That was a long night after that nonsense, and of course, she never came back. So obviously there was something to it where he had stolen stuff, and we never really did find out anything other than that. It's a whole confidentiality thing, so end up being a wash. It's one of those things where you don't see someone for 2 or 3 weeks, and then you end up just discharging them from services because, okay, well, I guess that's it. So yeah, that's my horror story number two. That's when you think the day's going to be great, and then all of a sudden it turns into a nightmare at the end of it. And you think you have things in place, and all of a sudden new processes have to be brought about because of someone's issues. In this case, someone's stealing someone else's stuff. So yeah, crazy. And Horror story number 2. I'm out of breath here. What's going on here? Keepers. And so, horror story number 3. So, we talked about in the past when there was a fall in the parallel bars. Talked about that one. Talked about the CPR one. This was home care. This is probably like, I might have been 3 months in doing home care the first time after I left SNF when I first moved down here. And so I go and evaluate this patient. The family says, oh yeah, they're in the back room. Go ahead and go back there. They're in the recliner chair. I'm like, okay. I knock on the door. I don't hear nothing. So I'm like, Mrs. So-and-so, it's Joe from therapy here to do your evaluation. Well, I could barely get through the door. Imagine this. There's the bed, there's the recliner chair, and then there's the door to enter and exit the room. And the room might be a 12 by 15, might be a 12 by 15 size. And this lady was big. I mean, she had to go at least 300 something, and she might have been 5'6" in height. So here I am. She's not really verbally responding to me at all. Like basic questions I'm asking, like her name, where she's at, just basic orientation questions. Just kind of in and out. So I yell for the family, for them to come on back. Hey, I need you to come on back here and help me with this. What's going on? Has she been like this the whole time? Well, she's been in and out. I said, has she been out of the recliner chair since she got home? Well, this lady's been home for 2 days. So I'm like, really? What the heck's going on here? So I start trying to get her to really get alert. So I'd start doing what's called a sterno rub, which is very uncomfortable. And if you do it hard enough, he should respond. Well, she'd come to a little bit. And so I said, has she gone to the bathroom in a couple days? No, not really. I'm like, neither. She hasn't gone pee or poop in 48 hours. No. I'm like, okay. All right, well, we got a problem here because humans do that. So I said, we're gonna have to call 911 and get an ambulance out here. Oh, really? I said, yes. So here I am. I was like, okay, I'm getting on the phone and calling. Oh, no. I said, oh, no, I am. So I called, got them there, had to get the fire. Yeah, I said, you better bring the fire department here because there's no way you're getting this lady out of here with just a couple of EMTs or paramedics. So they had to have 4 firefighters come out. They had to flip the bed up, move the recliner chair back with her in there to get her out of there. So, yeah, that's a horror story. Horror story number 3. Hello. I'll leave I'll leave my next horror story for next time, which is I found someone basically DOA is dead on arrival. So I'll leave that one for another episode. And they're never fun either. A lot of upset people, rightly so. And so all right. Until next time, look up and keep smiling. See you next time, folks.